Hi, you guys. Welcome back for our daily practice questions. It is day 30. And as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, digital flashcards, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success in their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 28-year-old patient presents with asthma symptoms occurring less than twice a month. They experience no nighttime awakenings and have no significant interference with daily activities. According to the GINA guidelines, which of the following is the preferred controller medication for this patient? Is it A, low dose inhaled corticosteroid, B, leukotriene receptor antagonist, C, as needed low dose ICS plus SABA, or D, as needed low dose plus ID, as needed low dose ICS plus LABA? What do y'all think? Tell me in the comments, y'all. All right. Now, y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you, right? So here the stem of the question states, according to the GINA guidelines, which of the following is the preferred controller medication for this patient? Now, y'all know, and you know the chart that I like to show you guys, but um, when you look at it, you'll see preferred controller, preferred reliever, and the alternate treatments, right? So I want you to pay attention to these terms because when you see these on boards, they're telling you specifically which area they want you to utilize, okay? But the preferred controller is a treatment. They state GINA, so we know the patient has asthma, right? So you need to determine what stage, what step are they in, so then you know how to treat, right? So this is a 28-year-old patient. They have an asthma symptoms occurring less than twice a month. There's no nighttime awakenings and no significant interference with daily activities. Y'all, this is the intermittent phase or step one, right? So there, we just simply want to give an as needed low dose ICS plus LABA, which is D. So D is your best answer. And remember, this is a combination medicine, right? It's an inhaler with an inhaled corticosteroid and a long-acting beta agonist combined into one inhaler. And so the dosages of these will simply increase throughout. But when you give the as needed one, that is low dose. So step one and step two, remember, are the low dose as needed. We're utilizing it PRN, right? Question number two. A 45-year-old patient with asthma experiences symptoms more than twice a week, but less than daily. They also have nighttime awakenings more than twice a month. According to the GINA guidelines, which of the following is the preferred controller medication for this patient? Is it A, a low-dose ICS, B, as needed low-dose ICS plus a LABA, C, a low-dose ICS plus a leukotriene receptor antagonist, or D, a SABA? Tell me what you got in the comments, y'all. Tell me what you got. Tell me what you got. All right, so stem of the question. According to the GINA guidelines, which of the following is the preferred controller medication for this patient? So again, preferred controller, and they're asking for the medication. We're looking for treatment. They're talking about the GINA guidelines, which is for asthma, right? So we know we're managing asthma. GINA being the global initiative of asthma. So let's see what kind of symptoms they have. So we have a 45-year-old patient with asthma. And this patient is experiencing symptoms more than twice a week, but not every day, right? It's less than daily. They also have nighttime awakenings more than twice a month. All right, so what stage is this? This is that mild persistent stage, right? So step two, mild persistent. So again, we would still do B, which is your as needed low dose ICS plus your LABA, right? Remember, in following those GINA guidelines, step 1 and step 2 as the preferred controller is an as needed combo inhaler of the with the ICS plus LABA, which can be like your budesonide plus formoterol, right? All right, and question number 3. A 60-year-old patient with asthma has daily symptoms and nighttime awakenings more than once a week. They experience significant limitation in daily activities. According to the GINA guidelines, which of the following is the preferred controller medication for this patient? Is it a high dose inhaled corticosteroid, B, a low dose ICS plus a LABA daily, C, as needed low dose ICS plus a LABA, or D, medium dose ICS plus a LABA? Tell me what you think, y'all. Take your time, but tell me what you get. All right. So, stem of the question. According to the GINA guidelines, which of the following is the preferred controller medication for this patient? So, again, same thing we've been doing in question 1 and question 2. We're looking for that treatment, but we are looking for the preferred controller, right? All right. So, this 60-year-old patient has asthma, but they're having daily symptoms and nighttime awakenings more than once a week. They experience significant limitation in daily activities. Y'all, this is your moderate persistent stage, right? So we're in that stage 3 range. And so here, stage 3 or step 3 is where we still use our low dose ICS plus the LABA, but it is now every day. Remember, this is that MART that they talk about. MART, MART, maintenance and reliever therapy, right? And so this is where you start to implement the things on a daily regimen versus as needed. So B is your best answer. You're still going to give those medications. It's still a combo inhaler, but now we're giving it daily. It's still at the low dose. Now, what happens is as we move up, so the next one, going from moderate to severe, you would still give the same one, but now the dosages are going to increase, right? So we go from a low dose to a medium dose. So if the combo inhaler is, and I'm just throwing out random numbers because it depends on which medicines are combined, but say it's like 80/6, right? Well, then when we bump up to the medium dose, then it would be 160/6 or /12. It's how they're low, medium, and high are broken down. But it's hard for me to just go into all that because I don't want to make it confusing because it could be a different variety of medications that are combined. But the one that we commonly see are, like I said on question 2, is like your budesonide and your formoterol, which is your Symbicort, right? So just paying attention to, I think y'all are getting confused. And I say this because even dealing with one-on-one sessions, I get this question. And I think it's confusing you guys because there's 2 medications, but they are combo. Just think like antihypertensives when we combine 2 medicines and make it 1 pill, right? So it's combined 2 medicines into 1 inhaler, but we start to shift the dose of it, the milligram of it, right? As the symptoms are uncontrolled, we're going to ump it to control it better, right? So that's all that I'm saying. So, and the reason that this shift, because think about it. Typically, we would tell you you need a SABA, you need an ICS, you need a LABA, and you have 3 separate inhalers. And people are not being compliant. So doing it this way is all bundled into one to give you a better coverage because they are adhering, because they are more compliant to the regimen, right? Because if I gave you 1 inhaler versus 3, wouldn't you do better? Wouldn't that be easier for you to maintain? And so when we get to stages like this, we go from low dose combo as needed, step 1, step 2. Step 3 is the first stage where we start to implement the daily regimen of the low dose, right? Instead of as needed. Then if the symptoms are still not covered, now we bump up to a medium dose of the daily regimen. And then after that, you can bump up to the high dose, or you can opt to add in a llama, right? So it just depends on what's working best for your patient. But all right, you guys, as always, I hope you found this helpful. Please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 888-400-6864. You can also shoot a text message to this number or shoot us an email to thenursestudio1@gmail.com. Everything that I do offer is linked in the bio of this channel, including my website. And if you're looking to book any of my one-on-one sessions, any of my private tutoring, any of my custom packages or plans, I always say either call, text, or email because I prefer to speak with you first to gauge what you truly need to ensure you're booking the appropriate session type, okay? All right, y'all. Y'all have been doing amazing, but y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.